Hello there, doctors. In today's episode, we're going to talk about why doctors should build a brand online and monetizations. And we're going to do common questions that are being asked about how to do this by doctors, because that's not what we're trained in med school, right? I'm Dr. Ann Trump.
I'm Dr. Mike Woo-ming.
And so we're going to do a Q&A question today, and we're going to answer one of the most common questions that are being asked is, doctor would ask, should I hire a social media agency for my practice? So most of us think, well, we're doctors. We don't know about social media and how to approach it. So let's just kind of dissect this down and say the bottom line is, no, you don't need to hire a social media agency because they're going to charge you an arm and a leg for it. And they may not even do the task that the outcome that you want, because the outcome that you want, why do you want to go on social media? Why? Right. First of all, you have to answer that question. Why do you want to be on social media? And don't think that you have to dance or do any weird moves like that. Why do you want to be on social media? And what is the outcome? What is the result that you want from social media? Okay. So I usually call it reverse engineering, is that you want to be on social media, but what the outcome of that? Is it driving patient to your business? Is it trying to create an online business, trying to attract brand? What is the outcome of that? So the more specific you are in the result that you want, then you reverse engineer back to what you need to do to be on social media. So the number one mistake that I see doctors do when they're on social media is that they talk about too many things. They talk about too many different topics. That may be things that they do in their practice, yes. But when you talk about too many things, the social media algorithm gets confused. And when I say social media, I'm talking about YouTube, Instagram, Facebook. They get confused. It gets confused in what the signal you're sending out. And so the more specific you are in what the topic you're going to talk about, let's say social media, we say YouTube, the more specific you are, then the algorithm can pick up the signals of those topics and then push it out to the viewers that are interested in that topic. Well, I'll tell you a funny story. I've been getting into historical Chinese C-drama lately. I've been watching that, and I've been watching that on YouTube. All of a sudden now on my YouTube algorithm, I'm being shown all these Chinese historical drama because it recognizes what my viewing pattern is. So number one is reverse engineer and know what the outcome that you want to be on social media. What do you think, Mike?
Yeah, I think you're spot on. Reverse engineer it. What exactly are you trying to do? What problem are you trying to solve? Are you trying to build more patients for your practice? Are you wanting to become a paid speaker? If you're unclear, an agency is just going to add to the confusion. Now, they're really good at getting you followers. They might be really good at getting you subscribers, but what is the quality of that? Last time I checked, I can't put followers or likes. I can't put it in a bank on there. So if you tell, like, and this is my example, because I've seen doctors who do, hire a social media agency. Oftentimes it's generic health tips, or they post on holidays, or they do stock photos, but they're not doing anything to help build you authority or generate patients for you. But the more specific you can be, let's say, you focus, I want to attract regenerative medicine patients, Orlando, Florida, and focusing on shoulder pain on here. Now you have a specific job. But most people, when they hire an agency, they don't have an offer. They don't have a clear idea of your niche or your audience. They don't have a conversion path to get people to sign up for their newsletter or book an appointment with them. And so you need to get those questions answered first before even considering hiring an agency.
And I love what Mike said, like, subscribers, and comment. Do not put anything in the bank account. So oftentimes the one that has the less subscribers and like make more money than the one that has more subscribers, because they're the one that know how to bring a viewer into a buyer, because that's what it counts. Because if you're on social media, you're doing this, you got to have some type of reward or payback, or else you're going to burn out. You're just going to do this. And if you're not seeing your bank account grow, then you're going to get burned out. And you're already running a busy practice. If you're running a practice already, whether it's insurance based or cash based, you already have that responsibility. Now, doing social media, now you can do it with maybe 5 hours a week or maybe 10 hours a week, but you got to have an outcome. And what Mike said earlier was that have a niche. Like the more specific, the better. You can do weight loss for women over 50, African American, or you can do, like for me, treating erectile dysfunction for men over 50 that are divorced or getting back to dating again. So even that specific, not just ED alone, but specific group of ED. The more specific you are, the more you can attract that particular person. And social media, the algorithm can really narrow down who you are targeting. And then when you are laser focused on that niche, you can really create better content. Trust me, I've been doing this for 5 years and creating social media content. And the more clear I am on who I'm talking to, the more I see in my bank account. And so the next thing is the offer. Like, what is the offer? What is the thing that you're driving that viewer into a buyer? What is that specific package that you are promoting? Is it a course? Maybe it's a course. Maybe it is a group coaching. Maybe it is one-to-one coaching. Maybe it is going to your office for treatment. And then that's the offer. And we'll talk another episode about how to create an irresistible offer as a physician using Alex Hormozi's formula. And he's currently my coach right now. That's for another episode. So the offer, drive them to the offer. And then you got to have a system where you can convert the viewer into your world so you can talk to them more. And that's what I'm leading this to, is some type of landing page or website. Not quite much a website, but landing page is a website, some type of a link that you click the link. And when you click the link, it goes to a page. And you go to a page, you get their email and their name, and then you offer them something free in return. And once they do that, you now can speak with them in email about your offer, about what you're offering them that will help them with their problem, right? Because it always starts with talking to somebody with a problem and how you're going to solve that problem. So there's 3 steps. It's niching down and then attracting and converting that person into a buyer, and then your offer. And all that has to align. It has to align. You can't be attracting a person that has, let's say, osteoarthritis knee pain, and then the offer is weight loss. So the offer has to align with the problem. And then you have to use some type of software like a CRM, where you can create what they call the funnel or the landing page to bring that person into your email system, where you can send them emails about the offer. And once you narrow that down, you have a business and you have a brand. One of the doctors we're working with in our Inner Circle coaching program is an orthopedic surgeon who we started working at the beginning of the year, now in June. And he started with 0 subscribers. But the channel that he had before was all over the place. He was talking about all about orthopedic condition. When we worked together, we niche him down, just talking about knee OA and treatment for knee OA. That's it. And started with 0 subscribers in January. 5 months later, not even 6 months, he now has 1,500 subscribers. Now, for YouTube, getting over 1,000 subscribers is a big milestone. That's a big, big milestone. Only about 30% of channels reach that level, and reaching it in 5 months is really good. But the reason why he's able to do that, because he has the niche. He has a conversion system, which is the landing page, where he gives them a cheat sheet on how to do a home-based program for knee OA, and then he gets their email. And then his offer is to drive them to their office for actually non-operative treatment for knee OA with platelet-rich plasma, stem cells, and laser therapy. So he has a package. So he has an offer, he has a niche, and then he has a conversion system, the landing page, and convert them all. That is it. That is how you get on social media and build a brand. You can do it fairly quickly, as long as you know what the outcome is. The outcome for Brad was to drive more business to the office and to become the go-to regenerative medicine doctor in Orlando. Do you have anything to add to that, Mike?
No, I think the main thing is don't outsource confusion. If you're confused at your offer, if you're confused on how you're going to convert them, whether through a landing page, what you're going to give them, if you're confused on your audience, don't hire the social media agency thinking they're going to solve your confusion. Because if you're confused, they're going to be confused. And I
Mhm.
see it so often where they hire the agency and they pay them hundreds, even thousands of dollars a month. And then they are hoping that social media is going to provide clarity for them. You're the one who needs to provide the clarity for the agency.
Well, I do want to add that you may not need an agency, but you're probably going to need an editor or somebody to post it for you. Okay. If you're going to do video, you're going to need an editor and then somebody to post it for you on the channel. Now, that you will need, because I don't recommend doctors doing editing the video themselves or even going to Canva and trying to create the social media images. But now you can probably do it with AI. But again, doctors don't do this. I see this all the time in Facebook group or doctors oh, I'll just hire a high school student or I'll just hire a friend of a friend that had done social media before to do this for me. All right. So the strategy should come from you. The person that does your social media should be taking directive from you, that they're more posting it and they're more and editing it, but you're the one that should be driving the strategy. It's like, yeah, this is my niche and this is the outcome that I want it to be. And so you have to hire good people to do the work. Don't hire a high school student that knows social media because they've been on social media and TikTok online and know how to record videos. Okay. So it's kind of like the same. Like, would you hire somebody that hasn't gone to med school yet to treat your condition? So be selective in that area. But I think if anything, if you're going to do video, get a video editor and just a social media VA. And then look at your metrics. Always, you cannot improve if you don't measure something. Don't fall for the vanity metrics of likes and subscribers. Initially, I was looking at my like and subscribers. Now I look at conversions and I look at buyers. My subscribers have not gotten a lot, but I have increased in buyers because I'm so narrow in who I'm talking to that I'm not attracting viewers, I'm attracting buyers. And buyers are always the smallest percentage. So I'm going for that 1% that buy from me and I'm talking to them directly. So I'm not going for subscribers and views. For me, that was my outcome. And just to remember, don't fall for that vanity metric. Anything else you want to add for this question before we move on to the next one?
I think was good. If you guys like these questions, I would highly encourage you to subscribe to our channel. We're always covering topics that focus on you. If you're a physician who are looking to build your brand online, to build extra income in or outside of your practice, and I highly encourage you to go and do that.
Okay, next question. Should I put Dr. MD DO on my Instagram bio? What do you think, Mike?
Yeah, it depends on what you want to do. If you're using it because you want to build your authority as a physician, why not differentiate yourselves with all the other influencers out there, health influencers who are not necessarily a healthcare professional? So you need to do something that has you stand out, that shows that you have credibility, that shows you have authority. You spend many, many years on trying to get that degree, whether it be MD or DO or DPM, go ahead and do it. And now if you're in a niche that doesn't have anything to do with health, maybe you want to be a stamp collecting influencer, if there's such a thing, then maybe that's not so important. But if you're building something in health or in medicine, then by all means, put those initials behind your name.
Absolutely, because you earned that credential and that's going to differentiate you from the other influencers that does not have that clinical training. I can't tell you how many people on social media that they have a personal journey of losing 50 pounds and now they're teaching people how to lose weight. But how many people have they treated? One, themselves. And we know that everybody's different. And so this is how you can differentiate yourself and then also differentiate yourself in your clinical experience as well too. Don't downgrade that. And also, when you social media, you can put MD, DO in there, but also think of yourself as being unique. What is it that make you unique that differentiate you from other doctors or other social media that talk about the same topic or niche? Because you are unique. You are unique in the sense that nobody is like you because nobody has the personal experience like you do. Nobody has the clinical experience like you do. Yes, you have other doctors training in the same specialty, but not the experience, the patient exposure, procedures, and the knowledge that you have, and then your own personal take on that condition. Like I treat ED, but my approach to ED is different than other doctors' approach to ED because I have a background of know how to do acupuncture. I know a background of functional medicine. I'm also an interventional pain doctor. I'm a physical medicine and rehab doctor. So I come with those combined experience, all combined together to make this special soup. And so all of you, doctor, you do have that unique, it's called USP, unique experiences
Unique
that
selling
set you apart.
proposition. Yeah.
Yes, unique selling proposition that set you apart. You just got to think about it, and that's what is gonna set you apart from even other peers as well. So the end point of this is that yes, put your DO, MD, DPM, your credentials in your name, and also separate your business from your personal account. And that's what I do. I have a personal and I have a business account and Instagram as well as Facebook as well too. So anything else we can add on this question?
Yeah, I wouldn't stop there. If you're John Smith, MD, don't just stop it there. And some people say, well, I'm an internal medicine or I'm a pediatrician. You could do more than that. And what we like to do is have not only that you're a physician, maybe you say that you're board certified, but also add like a I help statement template. Like I help a specific audience achieve a specific outcome without a specific pain or frustration. So, good bio includes who do you help, what problem do you want them to solve, and what outcome do you want. So, I help busy professionals achieve full regenerative health of their shoulder pain without surgery, something like that. Be more specific. And we keep stressing that enough. The more specific you are, the more it's going to establish yourself as the authority on that. So don't just stop with your MD or your DO, but what you actually do to help other people.
I love that. Awesome. Let's move on to the next one. How should medical professionals use social media responsibly?
Obviously, when you call yourself a physician, you are a physician on here, you've got a little bit more at risk than someone like a natural health influencer that is out there. You're set at a different standard on there. That means your post should be educational. It's got to be accurate. It's got to be professional. You have to be aware of health privacy issues and be respectful for this. And most importantly, is you have to refrain from giving personalized medical advice. When you are treating people out there, you're not treating them as a patient. You're just giving them education. You're just giving them knowledge. If you're using examples of a patient that you're using, teach principles. Don't give specific private details on it. The context is important. You have to avoid any specific privacy. I like to think of it as I'm old enough to remember when you would have it shows on the radio or on TV. It's always about general principles. It's not about specific patient details, which could get you in trouble with HIPAA.
Absolutely. So you can discuss about case studies. Of course, don't use real names or real age or anything like that. And like Mike said, the principles that's like, patient with hypertension, high cholesterol, 51 years old, and presentation of this and so forth. Just what you're trying to do is to show your expertise. When you're discussing cases, it's to show your expertise and set you apart from AI. With the advent of AI, free information is accessible. Patients are using AI for medical information and advice. And so, how you can set yourself apart is that you have case studies that AI can't cite case studies. AI doesn't have that clinical experience. And I use case studies all the time on YouTube. but I usually, if I saw a similar patient like a year ago, I would say a few months ago, and I usually change the age a little bit and just kind of present the principles that I want the audience to hear. So that's how you can do it. And remember, you're just educating. These people that are watching you, asking you questions on social media, you're not their doctor. So you always put a disclaimer on your bio or in your YouTube description that this is education only. Use it at your own risk. Always discuss with your doctor at this point. So you're just educating, and it's no different than anybody else on social media educating. It's up to them how they use it and discuss with their doctor. So that's number one. I know that this is a question that gets asked by doctors all the time. Liability. Until you enter into a patient-doctor relationship, which when they sign that paperwork that said you are now my patient, then they are not your patient. So you have no liability whatsoever. And so even as a physician, when we're teaching knowledge and principle that's based upon probably research-based and on our experience, which is unique than other non-physician as well. So I've been doing it for last 5 years. The people that ask us questions on social media know that I'm not their doctor. So when I engage with them on comment, I speak in generalities and principle, but I would preface it by discuss this with your doctor at this point. And people know that. Okay. Anything else you want to add before we move on to the next one?
Yeah, I think it's important. You need to separate your professional account with your personal account. Your job is to build authority. It's to get more patients, maybe build more consulting opportunities. Don't muddy the waters by putting in your personal. Now, it's okay to give yourself, things that you do outside your practice, human, but your job is to educate, it's to clarify, it's to build trust. It's not there to vent about something or to divert about what you want to do, what you're trying to get accomplished. So make sure you don't blur the lines between professional and your personal accounts.
Great. So we're going to be doing more of the specific Q&A. If you have any question, please put it in the comment and we will check it out and we will answer those questions in the upcoming episode. I hope you enjoyed the content so far. Let us know what you want us to discuss about in future episodes. We're here and our mission is to help you build a brand online and be able to monetize it so that way you can have passive income. What is passive income? Income that does not depend on you working one-on-one. I love the definition because when I earned my first passive income online, meaning I'm here with Mike, and right now somebody's buying my products right now that I don't have to work for, that makes me feel kind of like a little unique there because I've never done that before. So we're here to help you build that passive income. And if you want to dive deep into how to do this, join our communities at doctors with an S, onlinesuccess.com. The link is down below. Join our school group. We have free courses, training in there, and also it's a community of doctors helping one another how to grow online and build passive income. So having said that, I hope you enjoyed the episode. And remember, you're just not a doctor, you are a doctor bot.